This patient has undergone 5 different surgeries. Among them, the mid-face lift is a procedure that enhances the central part of the face. It specifically lifts drooping corners of the mouth, elevates sagging cheeks, smooths nasolabial folds, eliminates Indian lines, and creates a fuller mid-face, resulting in a naturally bright and smiling expression. The procedure is performed by making a 2 cm incision in the temporal area and performing subperiosteal dissection. A biodegradable material called endothene is then inserted. The endothene is inserted and positioned, featuring small hooks that secure specific facial structures. One hook is attached to the muscles at the corners of the mouth, another to the deep cheek fat, and another to the nasolabial fold fat. These structures are then pulled upward and anchored to the temporal fascia, effectively lifting and tightening the mid-face. Finally, the incision is simply sutured closed. The endothene material is biodegradable and dissolves naturally within approximately 6 months inside the body. Since the tissue has already been lifted and repositioned, the results remain intact even after the endothene fully dissolves, ensuring that the lifted areas do not sag again. As seen in the patient's post-surgery photos, the corners of the mouth have been lifted, Indian lines have disappeared, nasolabial folds have been smoothed, marionette lines have been reduced, and sagging cheeks have been elevated and reshaped. As a result, a subtle cheek projection appears in the area where the Indian lines were, creating a naturally smiling expression. When the mid-face projection is enhanced, it gives the impression of a smile even when at rest. Additionally, since the corners of the mouth are lifted, the face naturally looks more cheerful and youthful. Before surgery, the facial contours were less defined, and there was no clear distinction between the front and side of the face. However, with the enhanced cheek projection, a contour line is formed, extending from the outer corner of the eye down to the jaw, creating a clearer definition of the front of the face. The area behind this line appears as the side profile, making the face look slimmer. Additionally, as the deep cheek fat is lifted, the previously sagging jawline becomes more defined, transforming into a V-line shape, giving the face a more slender and refined appearance. As a result, the lower face forms a V-line jawline, while the area around the mouth develops an egg-shaped contour, which is a key characteristic of the mid-face lift. The second surgery is lower eyelid surgery, lower blepharoplasty. This procedure involves making an incision under the eyes to reposition the fat, remove dark circles, and create aegiosal, charming fat under the eyes. Creating aegiosal gives the appearance of a subtle smile even when you're not smiling. When you do smile, your expression looks even brighter and more radiant. In the past, lower eyelid surgery used to remove both the skin and muscle under the eyes, which also eliminated the natural aegiosal. In the past, the focus was mainly on smoothing out the lower eyelid area. However, as the importance of aegiosal has gained recognition, modern lower blepharoplasty techniques now tend to gather the muscles under the eyes to create aegiosal, making these procedures more popular. Mid-face lift surgery pushes the tissues in this area upward, making it easier to create a thicker aegiosal. When a mid-face lift is performed along with lower blepharoplasty, it creates a natural fullness in the mid-cheek area and lifts the corners of the mouth, giving the appearance of a subtle smile even when the face is at rest. Adding aegiosal enhances this effect, making the expression look even more cheerful. And another important point is that with a mid-face lift, all the tissues in this area are pushed upward, right? Lower blepharoplasty can cause a serious complication called lower eyelid ectropion, where the eyelid turns outward. However, this procedure makes it easier to prevent such complications. The eyes maintain a natural and slightly smiling appearance without becoming smaller, while also preventing lower eyelid ectropion. This is one of the advantages of combining a mid-face lift with lower blepharoplasty.